Hi, I'm Dr. Norman Rowe and I'm a board-certified plastic surgeon. I'm here to talk today about penile augmentation, some of the nuances of it, what it entails, what you can expect, and some of the outcomes. What is a penile enlargement? There are two ways that a penis can be enlarged, and that is surgically and non-surgically. I'm here to talk about non-surgical penile augmentation. Now, the main focus of a non-surgical penile augmentation is increasing the girth or the circumference of a penis. A lot of my patients come in and they have the misconception that if you increase the girth of the penis, it will also increase the length of the penis. And there is a lot of misinformation out there on on the internet and various websites. The majority of non-surgical penile augmentation only augments the girth. There really is no good, tried and true way in order to increase the length of the penis other than with surgery, which again we're not going to speak about. But the non-surgical penile augmentation for the circumference involves a series of shots into the penis in order to increase the girth. The way the HA or hyaluronic acid works is it adds volume to the penis. It adds circumference. It gives an increase in circumference to the penis. It is done through a series of injections in order to increase the penis to the circumference that you desire. The unique thing about the penile skin is, as you may know, it's made to stretch. So a patient can put in as much or as little of the filler as they desire. The second type of broad category of filler that I use in the penis is platelet-rich plasma, or PRP. Now, you may have heard about this product. It is something that sports stars use to treat any form of injury to their shoulders or legs. But what that involves is we draw your blood, and in your blood, in addition to red cells, white cells, are platelets, and we specifically take out those platelets and inject them into the penis. Now, a lot of people take the platelet-rich plasma, or PRP, and inject it into the penis in order to give increase in girth or increase their circumference, much the same way that I inject HA, or the hyaluronic acid. But I find that when you use the PRP in order to increase girth, it does not last as long as a hyaluronic acid. So I use the PRP mainly as a functional improvement in the penis. I inject it in the position of the penis in order to increase blood flow to the penis, so it mainly aids in a patient who may suffer from erectile dysfunction, or ED. With the PRP, it does require a series of 3 treatments about a month apart and then once annually. The reason for that is there is usually an ongoing issue that causes the erectile dysfunction. So it's an ongoing treatment, whereas the HA, hyaluronic acid, is kind of more of a one and done. You get as many or as little treatments as you want until you get to the size of the penis that you desire. Now, with both treatments, they are painless. Each treatment involves one shot at the very beginning of the treatment to the penis in order to numb up the penis so that there is no pain involved in either therapy whatsoever. We do also add a topical painkiller to the penis, so all of our patients know that there is no pain involved in the treatment whatsoever. Now, the HA, the hyaluronic acid, is mainly used for increasing girth, cosmetic, and the PRP I mainly use for functional improvement. Now, you may ask, can I get both treatments? And the answer is yes. The HA is used for increasing the circumference, and the PRP is used for increasing the performance or the function of the penis. You may wonder, what portion of the penis can you have enhanced? With the HA, you can enhance the shaft of the penis. You can also enhance the glands or the head of the penis, and even the corona or the rim below the head of the penis. Any portion of the penis can be enlarged. The way I augment the penis is I give a series of injections along the shaft of the penis as well as the corona and the glands if the patient desires. I enhance the sides of the penis as well as the top or the dorsum of the penis. I tend not to put too much filler along the bottom of the penis because that is where the urethra, or where you urinate from, goes to the penis. And I don't want to put too much of a filler in there, because if you put too much filler along the bottom of the penis, you can obstruct the urethra and making urination more difficult. With regards to the PRP, if I am using PRP to enhance the function of the penis, I mainly inject that a little bit deeper within the penis in order to increase the function of the penis. There are two types of platelet-rich plasma. There are platelet-rich plasma. There are two types of platelets that can be injected into the penis: platelet-rich plasma and platelet-poor plasma, the PPP versus the PRP. Most therapies involves a combination of both, or a mixture of platelet-rich and platelet-poor plasma, and that is injected into the penis. With my technique, I separate the platelet-rich, which is the better platelets to inject, from the platelet-poor. So my patients get a dose of only platelet-rich plasma in order to increase the efficacy of the treatment, which increases the function of the penis. Let's talk about time of the treatment. The HA, or injection with hyaluronic acid, takes about 20 minutes to 30 minutes from start to finish. That is from the time you walk in the door of my office to the numbing to the treatment. And again, a patient can have as much or little as they desire. And again, if someone decides, I want to start with, let's say for example, 10, 15 milliliters or cc's of the HA, they can do that. And if they would like to have more added, they can always come back and add more to the penis. Another good thing with regards to the HA, or using hyaluronic acid, is if for any reason the patient decides they don't want to have the enlarged penis, there are medications that can be injected into the penis to dissolve the HA. With regards to the platelet-rich plasma therapy treatment, that takes about 30 minutes to about 40 minutes because it involves drawing your blood, like much the same when you go to your internist to have your annual physical and they draw your blood. It's the same process. We draw your blood, get the platelets, get the platelet-rich plasma, and treat that. That takes on average about 30 to 40 minutes. So it can easily be done during your lunch hour. With regards to the effect of these treatments on someone's libido or their sex drive, obviously the hyaluronic acid really doesn't affect your libido or the sex drive. It purely enhances the size of the penis, which most men state after they're having treated. Not only are they happy with the results, but also their partner. As far as the PRP, what that does increase the blood flow to the penis, so it does enhance the, now with regards to the platelet-rich plasma or the PRP therapy, that does enhance your sex life and your libido in the effect that it helps someone attain and maintain an erection. I've had patients ask me if either one of these treatments will affect their ability to have children in the future, and the answer to that is no. If someone is able to have children or not able to, neither one of these treatments will affect that in the least. Now, a lot of our patients ask, does the treatment hurt? And the answer to that is no. I do give a patient a numbing shot at the base of the penis, one shot with a small needle, feels like a little bee sting, and after that, the entire process for either treatment is painless. Patients also ask me, are there any side effects to this treatment? Now, as I stated before, there is no impact whatsoever on someone's ability to have children. With regards to the HA, there is a chance for slight asymmetries, which can be corrected at a follow-up visit. With regards to the PRP treatment, there are minimal, if any, side effects. With regards to either both of these treatments, I do prescribe antibiotic for 3 days after the treatment in order to minimize the chance for any type of superficial infection. Now, after the treatment, I tell my patients to abstain from sex for 48 hours, and that is to allow some of the swelling and bruising to resolve. Now, one of the good things about the treatment is with the HA, the results are seen immediately. With regards to the PRP treatment for functional improvement, it does take at least 3 treatments in order to get the improvement in the functionality of the penis or an improvement in treatment for the erectile dysfunction. Any other questions or would like to schedule a consultation, please contact my office at 212-628-7300, or you can make an appointment through my website at www.normanrowemd.com. That's NORMANROWEMD.com. Thank you.